Hi, good morning. We shall discuss about the armamentarium which we are going to use in basal implantology. That is the handpiece, the drills, and the various kinds of implants we are going to use during the basal implant placement during the surgical procedure. In my hand, I have contra-angle handpiece. You can see. So this contra-angle handpiece is useful when you are doing the surgical procedure in the mandible, that is anterior mandible as well as the posterior mandible. Since it's contra-angled, you will have good accessibility to the site where you are going to place the implant. So it's a 20:1 gear ratio contra-angle handpiece. I use woodpecker physio dispenser where the maximum speed will be 20,000 rpm and the torque I can keep up to 60. That is not needed for a regular implant placement. Your torque may be some 35 to 40, or the speed you can place up to 2000 rpm depending upon the quality of the bone in the cortical area, that is a D1 or D2 bone. The D2 bone is the ideal bone for placement of the basal implants both in maxilla as well as mandible. So this is contra-angle handpiece. I use this for the mandible, and this is a straight handpiece which I use it for the maxilla. I use a Kawa handpiece. The gear ratio is 1:1. So I use this straight handpiece in the maxillary area. I use this straight handpiece both in the anterior as well as the posterior region of the maxilla. That is placement of incisors premolar till there until the posterior, the mandibular area of the second molar, the maxillary second molar, and also while placing the implant in the pterygoid area as well as the tuberosity area, I use this straight handpiece for the osteotomy purpose. Okay, so handpiece, I use these three handpiece. So that is the surgical placement of the implants. So when I come to the drills, there are various types of drills we use. First is the point drill, or it is also called as a pilot drill or the marking drill, which is the drill which is of the same while placing the implant, whether it is a conventional or the basal implant. That is the mark drill or the pilot drill, where you are going to place the implant. You are going to mark that area, that is the pilot drill. Sometimes in basal implantology, what I use is I usually do the osteotomy with the pilot drill. I'll go till whatever the length of the implant I'm going to place. If I'm going to place 18 mm, 20 mm or 23 mm implant, I will start the osteotomy with the pilot drill up to 21 mm, 22 mm. So after the pilot drill, directly I'll place the basal implant. It's sometimes. So when that basal bone is not that hard, okay, when you can do the drilling normally without any hard work. When your drill is going easily, so after the pilot drill only you can place your basal implant. Okay, you can push the thread in complete threads. You can push it with your hand driver. So the pilot drill is the marking drill one, and one more then is the conical drill. Can you see this? This is the conical drill. These conical drills, usually I use these conical drills while placing the compressive implants. You can drill for the BCS implants also, but preferably while placing the compressive rough surface implants, I use this conical drill. So this is the conical drill. So conical drill will be having a different dia and length, starting from 2 mm dia, 2.6, 3 dia. So the length varies from 18, 20, 21 like that. So usually you get to two drills, a 2/20 or otherwise a 3/30 mm length. This is the conical drill to place the compressive implants. So you have the one more drill while placing the basal cortical screws, that is a twist drill. I'll show you the twist drill. So twist drill will be to place the implants in the maxillary anterior and the mandibular anterior region. So that is the twist drill. I'll just show you the drills. Okay, twist drill. Okay, give me a second. Twist drill. Okay.